Music Therapy Cbmt Preparation Gilliland Quiz Part 7 Questions with Explained Answers. Question 1. The comprehensive term for observing, coaching, processing, and evaluating skills of a music therapist is called Option A, intervention. Option B, administration. Option C, supervision. Option D, reflection. The correct answer is Option C, is supervision. Explanation. The definition of supervision includes the elements listed in the question: observing, coaching, processing, evaluating skills. Question 2. A developmental disorder in which there is a defect in the bony covering of the spinal cord that sometimes results in protrusion of the cord in many ings is called Option A, spina bifida. Option B, hydrocephalus. Option C, spinal meningitis. Option D, scoliosis. The correct answer is Option A, spina bifida. Explanation. Spina bifida or open spine is a condition in which the membrane or many-ings covering the spine pouch out to form a sac at a point along the back. Question 3. While working with a child, the music therapist raises her eyebrows when the child reaches for a mallet, which is an off-task behavior. The child immediately pulls her hand away. The therapist has Option A, reinforced the off-task behavior. Option B, ignored the child's response. Option C, communicated limits. Option D, reinforced on-task behavior. The correct answer is Option C, communicated limits. Explanation. Raising the eyebrows communicated limits because the effect was that the child pulled her hand away. Question 4. An individual has the following cluster of symptoms: failure to develop peer relationships appropriate to developmental level, apparently inflexible adherence to specific, non-functional routines and rituals, clinically insignificant general delay in language, clinically insignificant delay in cognitive development or in the development of age-appropriate self-help skills, adaptive behavior, or curiosity about the environment in childhood. Which of the following is the specific diagnostic label? Option A, autistic disorder. Option B, Rett's disorder. Option C, Asperger's disorder. Option D, childhood disintegrative disorder. The correct answer is Option C, Asperger's disorder. Explanation. Per the DSM-IVR, this is clinical presentation of Asperger's disorder. Question 5. In an educational setting, all of the following are sources for assessment data except Option A, the school record. Option B, client consultation. Option C, clinical observation. Option D, peer interview. The correct answer is Option D, peer interview. Explanation. Interviews with peers are not an appropriate/valid source for assessment data. A therapist would consult only with legal guardian, and/ or a direct relative/caregiver due to HIPAA privacy rules. Question 6. At the beginning of a session, a client is asked to choose an instrument and play along. The music therapist improvises a chant about a client's instrument choice, the view from the therapy room window, and the fact that they are together for music time. The therapist is most likely addressing which of the following objectives? Option A, improving orientation to the environment. Option B, enhancing decision-making skills. Option C, increasing the client's self-esteem. Option D, providing opportunities for musical self-expression. The correct answer is Option C, increasing the client's self-esteem. Explanation. Answer A, the chant helps to increase the client's awareness of his own actions, self, his environment, space, and the fact that they are together in the music session, time. Question 7. A young, adult client with a mild mental impairment calls the music therapist's home to explain her absence from several group sessions. The client states she has had leg surgery and also lost her stepfather to a sudden illness. How should the therapist best respond to her call? Option A, allow the client to express her feelings, offer her verbal support, and explore how she is coping. Option B, briefly acknowledge the client's concerns and direct the conversation to a lighter subject. Option C, determine if there is an immediate need and suggest she make an appointment with a counselor. Option D, acknowledge the client's feelings and suggest they talk at the next scheduled session. The correct answer is Option D, acknowledge the client's feelings and suggest they talk at the next scheduled session. Explanation. Acknowledging the client's feelings is important. Talking at the next session respects the boundaries of the therapeutic relationship.